Welcome back to A Slice of News, where I cut you off a slice of news. When it comes to healthcare, Republicans have been very clear what they don't want. They say Obamacare has got to go. Americans deserve better healthcare. We don't like it, we don't want it, get rid of it. But when it's their turn to then give a counter proposal, a Republican health plan, it's usually just, oh, give us some time. It's coming. They love to chant repeal and replace, repeal and replace. They're definitely gung-ho on the repeal part. But when it comes to replace, they're not very clear on replace it with what. In typical Republican fashion, they don't actually have a plan. Like a petulant child, they say, I don't want that. And so you say, well, what do you want? I don't know, but I don't want that. And once again, Democrats have to be the adults in the room and have a real solid health care plan, which is, of course, the Affordable Care Act, which has been providing health care for millions of Americans. As I think we can hardly forget, health care, or more specifically, extending the Affordable Care Act subsidies, was at the heart of this last government shutdown. Democrats in Congress pushed so hard to keep those subsidies going because they knew the Republicans did not have any alternative. And if those subsidies were allowed to expire, healthcare premiums for millions of Americans would shoot up because Republicans did not have any sort of alternative way of keeping those healthcare premiums lower, the way the Affordable Care Act had been doing and would continue doing if the Republicans would allow them to. One of the concessions for ending that government shutdown, basically the concession, was the Democrats would be allowed to have a vote on extending those Affordable Care Act subsidies. That vote is coming up this week. On the table is a 3-year extension to those Affordable Care Act subsidies, and from what we can tell, Republicans are all going to vote against that. And that was probably always going to be the case, which was part of why so many were so mad at the Democratic leadership when they seemingly caved to Republicans and ended the government shutdown, despite having spent 43 days very resolute and firm on they were not reopening the government until they agreed to extend those subsidies. Because Republicans agreeing to a vote that they know for a fact they are going to just vote down and not allow to pass is about as useful as a parent saying to their child that we can vote about if you can have ice cream for dinner. I'm going to vote no and it's not going to happen, but you can't say I didn't give you a chance. It's entirely for show, for appeasement. It does absolutely nothing functionally. Republicans treat this like a game, while on the line is 24 million Americans' health care. Because in less than a month, without the extension of the affordable health care subsidies, their health care premiums will double, in some cases even triple, making it impossible for many Americans to afford health care at all, and they will simply have to go without any sort of medical insurance. Because the health plans that they got through the Affordable Care Act marketplace was the only way they could afford health care at all. Paying out of pocket was simply not an option for them. So letting the Affordable Care Act subsidies expire would make healthcare entirely unaffordable for these people, many of which are concentrated in rural areas, many of which are Republicans. People who voted these people into office are going to lose their health care because they do not want to allow Democrats to get a win, quote unquote, and allow those health care subsidies to keep going for another few years, at least. If they was ever assigned to these rural, low-income Republican voters that their party simply does not care about them, this is definitely it. They care more about giving tax cuts to billionaires than the literal health of their own voters. And Democrats have tried to communicate this fact many times in the past, especially during the government shutdown. There was a great deal of messaging saying, if you guys don't, your representatives, to allow these subsidies to keep going, you are going to see your health care become completely unaffordable because your premiums are going to explode. But the Republican propaganda machine is strong, and many of them are convinced that the Affordable Care Act is a waste of money that doesn't work, and it's got Democrat written all over it anyway, so it just has to go. While conveniently, or I suppose in this case not so conveniently, not having any sort of alternative to it for after those subsidies expire and the premiums start going up. The Republican health plan seems to be no health plan at all. Either pay the raised prices or you just don't get health care. The Republican messaging on health care is actually pretty clear. It's basically, it's not our fault you're poor. That sounds like a you problem. And this isn't to say the Affordable Care Act is a perfect system either. Healthcare in this country being a for-profit business is in itself a problem that does need eventual addressing until that hypothetical future time occurs. The Affordable Care Act is basically the only thing we've got going that's at least somewhat working in the system that we find ourselves in. And a majority of Americans get that. According to a recent Gallup poll, 57% of U.S. adults approve of the Affordable Care Act. Of those surveyed, 91% of Democrats said yes, and 63% of independents. The only ones who didn't say they approved it were Republicans. It only came out at 15%. It really shows you just how deep that Republican propaganda goes. That while nearly 60% of Americans are okay with it, nearly 85% of polled Republicans still say no. Let's remember, no sort of Republican alternative. They say they don't approve of the Affordable Care Act, but they don't really have any alternative solution. Republicans are always so keen on telling people to pull themselves up by their own bootstraps, even though many of those same people don't even have any boots in the first place. And as a result of that mindset, when that vote comes up this week to extend those Affordable Care Act subsidies and Republicans refuse to vote in favor of it, and it does not happen, we are going to find ourselves in a health care crisis. People will die because the health care that they needed was completely unaffordable to them. And the sad thing is, like I said before, the ones that are going to be affected the hardest are going to be those rural Americans, which are in large part Republican voters. And Republican or Democrat, nobody deserves to suffer and possibly die purely out of an inability to pay for health care, purely because they live in a country that prioritizes the profits of healthcare companies and the enrichment of billionaires over the health and well-being of its people. And one of the most frustrating parts of it is it doesn't have to be like this. A for-profit healthcare model doesn't have to be the way we have our health care. Most of the rest of the developed world figured out a way to do it, but this country is stuck in a mindset of healthcare is something that you need to afford. You have to deserve. So if you don't have the money to pay for it, you don't deserve it. It's an overly cruel way to approach public health, because it makes health into something you literally have to buy. If you've got the money, you can buy the health, but if you don't, you're left up to random chance. And oftentimes that chance does not fall in your favor. For so long we've claimed that America is the greatest country in the world. Yet how great can we really consider ourselves when we make healthcare something that is limited only to the privileged, and those with less means are left to suffer? From the outside it seems wrong. It feels wrong. But they would say no. That's just business. And that's just it. Public health shouldn't be a business at all. As a nation, we have the resources necessary to make healthcare available to everyone, regardless of how much money they have or what job they have. It's not that we can't have something like Medicare for all, or something just better than the Affordable Care Act. We can. We just don't, because the healthcare industry makes too much money to disrupt. The kind of socialized medicine most other countries have around the world is shouted down as anti-capitalist socialism. We can't have it because that would betray the very capitalistic ideals that this nation was built upon. That is, of course, complete nonsense, and an obvious excuse to just allow the rich to remain rich and only get richer. But until we break out of that mindset, whenever that may be, hopefully sooner rather than later, until then, something like the Affordable Care Act, keeping it going at least a little bit longer, is really the best shot we have, the only shot we have. It's not the best healthcare solution, but it's better than the no healthcare solution, which is all the Republicans ever seem to put up on the table. But despite that fact, when the 3-year Affordable Care Act extension is put up for a vote, it will fail, because even getting the minimal amount of Republican support to get it passed seems like a fantasy. And when the Affordable Care Act subsidies don't get extended and we fall off that healthcare cliff with insurance premiums doubling and tripling on January 1st, a lot of people are in for a very rude awakening. And I told you so. It's going to be much comfort. Alright, guys, that'll be it for this episode of A Slice of News. I've been your host, Mr. Slice, and until next time, when I cut you off, another slice of news.